Good afternoon. This is John Horwich, President and CEO of Easterseals, DC, Maryland, and Virginia. Thank you for joining us today. During a time of so many challenges, our vision to create a hopeful, inclusive community where all people realize their potential and live meaningful lives is more important than ever. If you'd like to get involved in helping Easterseals realize our vision or have any questions, please email info@ecl.org. As we see vaccination availability increasing and the long-awaited reopening starting, racial, economic, and disability equity in vaccine access and addressing vaccine fears are critical to getting back to normal. That's why Easterseals DCMDVA is thrilled to present today's panel of experts, which includes Dr. Van Coots, the President and CEO of Holy Cross Health here in Silver Spring, Maryland, and during his time as an active duty Army officer, the commander and CEO of Walter Reed, where he helped establish Easterseals Little Warriors Child Development Scholarship Program to ensure that wounded warriors can focus on their recovery and rehabilitation while their young children benefit from Easterseals' high quality, inclusive early childhood education. Dr. Vashaili Geib, the market medical executive of Cigna Mid-Atlantic, who is also in private practice in Winchester. Brooke, Kaiser, Senior Director of Respite Services at Easterseals, DC, Maryland, and Virginia. And Secretary John D. King, President and CEO of the Education Trust and the 10th U.S. Secretary of Education. Our moderator today is Darnell Burton, Vice President of Development at Easterseals, DC, Maryland, and Virginia. We'll be kicking off today's program with a survey that will be on your screen momentarily. And when we return, the panel will continue with our moderator, Darnell. I hope you enjoy the program.
Good morning, good afternoon. I am here. I am taking the survey. But as we're taking this survey, I want to first say thank you all for attending. We really appreciate you being here. Again, I'm Darnell Burton, Vice President of Development here at Easterseals, DC, Maryland, Virginia. My goal today is purely to facilitate, hopefully not to talk too much, because there's tons of talent on this panel today. What I'd like to start off doing, just so we have an understanding of what's going to happen today, is give everyone an opportunity, 2 or 3 minutes to introduce themselves, talk a little bit about their background, and then from there, pose a question, and then have that question and take us into a conversation mode than just a Q&A. So I'd like to start off with Secretary King. Would you please introduce yourself?
Sure. Well, thanks for the opportunity to be a part of this conversation. I come to this conversation really as an educator. I was a teacher, a high school social studies teacher, a middle school principal, Secretary of Education for President Obama, and now I run an education civil rights organization. And I worry a lot about the impact of this period, this COVID-19 period on kids, and the urgency of making sure that we address students' academic and socio-emotional needs. I'm also a parent of 2 Montgomery County Public School students, 2 high school students, and so very, very concerned about making sure that they get the opportunity, hopefully, to get back to school safely.
Secretary King, I'm right there with you with a high school student who is bothering me about playing high school sports. So I will be glad when this is over so he can get out my house and stop asking me that question. Brooke Kaiser.
Hello. So I have been with Easterseals for 14 years and been running the Respite Care program. So I work with military families who have children with special needs or disabilities, providing respite care. Also with our little warriors, those are children whose parents have been injured in war, and veterans and our first responders. So I'm hearing a lot from the community regarding vaccines, their concerns, their fears. Now that more people are getting vaccinated, is it safe to be with other people who have been vaccinated? Also, with kids going back to school who aren't vaccinated, there are those concerns, and also vaccines for children who have special needs and disabilities. So there's a whole lot of information I've been gathering from the community.
Brooke, I can't wait to have that conversation. One of the things that I'm having here in my home is my wife and I will be vaccinated, and I have a daughter who's a college freshman, and she has some questions about the vaccine. So how do we integrate that into a vaccinated partially and partially not vaccinated home? So look forward to having that part of the conversation. Dr. Geib, you're on mute there for us. There we go.
All righty. Hi, it's so great to be here. My name is Dr. Vashaili Geib, and as you mentioned, I'm the Mid-Atlantic Medical Executive for Cigna. And I serve as the clinical lead for our value-based arrangements in the Mid-Atlantic market. And I work with our network strategy on designing new products and solutions. But I'm also a board certified internist, and I continue to see patients in a community practice in Winchester and have done so throughout the pandemic. And I'm really excited to share my experiences as a doc. I've had patients come into me almost on a daily basis asking me questions. Should they get vaccinated? Where can I find the vaccine? And I'm really looking forward to our conversation today.
Look, this time it was me. I was on mute that time, and I'm just sitting here talking. And look, and I've done this plenty of times, so don't feel bad if anyone makes that mistake. Last but not least, and then we'll start with you, Dr. Van Coots.
Yeah, well, so good afternoon, everyone. So I'm Van Coots. I'm the president and CEO of Holy Cross Health, a 2-hospital health system here in Montgomery County with 4 large community clinics that serve the most needy, the most underserved, and mostly charity care patients as well out in our community. My 2 hospitals have been located in the hot spots in Montgomery County. And for the past 55 weeks, we have been at the tip of the spear of this. We actually diagnosed the first 2 cases in the state of Maryland on the 4th of March, and the 3rd case associated with Washington, D.C.
Wow.
And since then, it has been Mr. Toad's wild ride through no medication, some medications, the changes in protocols, the wild west of PPE, where our spend went 500% above where it was last year in terms of just PPE alone. And then the questions around the vaccine once the vaccine came out. To this date, we've given about 23,000 vaccines out. And of course, it's limited by the supply. I'm also the parent of 2 students here in Montgomery County, both of whom go to a private school. And for the last year, I've served on their medical advisory board because our students have been in school the full time. So making sure that they could stay in school or stream when there was potential positive case or some other reason that we needed to back off of full-time school to keep them safe. So as a parent of children who need to be vaccinated too, I mean, I'm right here with everyone else as well.
Dr. Coots, first of all, thank you. Thank you to everyone that's joined this panel today. I think this may be the first time when we actually have an all Maryland panel. Traditionally, we're all over the country, and so this is fantastic. Not judging any of the folks that are chiming in that are not from Maryland, but this is the first time we've probably had a panel like that. Secondly, I want to point to everyone that's outside chiming in today to understand that you guys can ask questions at any time during this conversation in the Q&A box. And please feel free to ask any question. There's nothing off limits here today. And at the time when someone's talking, one of the panelists will get a chance to answer your question, and or we'll take it as a group. And then lastly, again, thank you guys all for being here today and participating. So I'll start with my question. Dr. Coots, since we're going to start with you, I want to talk about what have been your thoughts or your views on the rollout of the vaccine. 1, has this been effective? 2, has this been efficient? And 3, has there been levels of equality as it pertains to the vaccine for people of color?
Okay, well, thank you very much. That's a very loaded question with about 100 different parts to it. I'll start out by saying that I'm very glad that we're rolling out the vaccine now with the speed with which we are doing it. At first, there was really no unified national leadership around the pandemic in general, state to state. And so our fear was that was what was going to happen with the vaccine. Operation Warp Speed kicked in, and I retired as a general from the Army, so General Perna and his group, and a lot of the people that worked in the vaccine are people that I had worked with during my time on active duty. So I had confidence in the development and the rollout. The supply, the issues around that are what have actually slowed us down as we have rolled the vaccine out, the availability of it, and then the ability of people to get online and get appointments and get in has been problematic. Those who had computer access and who could afford to sit on the computer all day to log in and get an appointment could do it. In our hotspot areas where people were essential workers and had to work and couldn't sit on the computer all day, or did not have access to a computer, or did not have internet in their homes. We know there's a certain amount of the population, very much a brown and Black community issue, that we're actually not reaching, but really a frontline level worker issue as much as it is anything else. So there are a multitude of things. And I know I didn't give a complete answer on that, but that is because, you know, we're dealing with conundrums every day still when it comes to dealing with the vaccine and making people have access, making sure that people have access to be able to get in and get it.
Anyone else want to chime in? Please feel free to do so. Dr. Geib, Brooke, or Secretary King. So no, the question was again, how do you guys feel about this rollout happening? Has it been effective? Has it been efficient? And what have been your thoughts on underserved brown and underserved communities and those of brown and Black of hue?
I would second what Dr. Coots said, you know, just taking it down into the trenches in practice. You know, physicians and my physician colleagues have been inundated, you know, with calls by our patients asking us, where can we get the vaccine? And, you know, as he mentioned, you know, many of my patients, especially in Black and brown communities, didn't have the luxury to sit by their computer with a high-speed connection and hit the refresh button every 20 seconds. I'd get many, you know, people telling me that by the time that they actually logged on, the vaccine appointments were taken. So I'm actually, you know, I think that that's a function of the fact that we just didn't have enough vaccines at the beginning, and that the demand, you know, did initially, you know, outpace the supply that we had. So I'm hopeful with the vaccines that are coming out, especially with J&J, that we're going to see less and less of that and more opportunity for those people to get the vaccine who don't necessarily have a smartphone or a high-speed internet connection.
Brooke?
Yeah, I think also there are so many individuals in the community who aren't computer savvy, or, you know, the older generations. I've been helping individuals who are 85 years old, and, you know, the one person in particular, she didn't really have the resources to get online, to sit at the computer, as so many people have mentioned. But also, it's a ongoing process. You have to be, you know, on that computer 24/7, refreshing and doing all this. And if you don't have a sense of computer savviness, or you're not quite sure how to work your smartphone or phones in general, it is really a negative for you, because there are so many other people who have that technology experience and they get ahead of you. So it's been nice to see that the community has really come together to help those individuals, or who maybe those who have a language barrier. The whole process is confusing, especially when there are literally 50,000 sites that you need to sign up instead of having one big dashboard, kind of like an Amazon, where everyone could go put in their information. But you have to click so many different links, whether it's Giant, it's Walgreens, it's a hospital, and that all is very confusing to so many.
Hey, Brooke, I will be honest with you, and then I'm going to swing over to Dr. King. I probably signed up 10 different places, right? And I akin this to the Hunger Games, and I joke, but I'm very serious, is first come, first serve, right? And I woke up at 7 o'clock on a Sunday morning and had gotten a call and an email to come take the shot when I didn't even know which site that came from. And literally was like, what did I do to get this? And my wife was like, hey, I'm a teacher, I haven't even got mine. And so it was very strange. And now she got hers. And there seems to be a change and more of a deluge since the J&J vaccine has come out. And so I want to switch and pivot a little bit from medical professionals and talk about education a little bit. Dr. King, can you speak to this from the education side about what you're seeing about this rollout, about what you're hearing, about some of the things you're feeling from some of the folks talking about the vaccine? And then I want to talk to everyone else about how folks are feeling about the vaccine in general.
Yeah, I think it's been very helpful that the federal government, the Biden-Harris administration, has communicated clearly to states that they should prioritize teachers for the vaccine distribution. For our country, it is urgently important that we get students safely back to school, and making sure that teachers and other school staff, whether it's bus drivers, folks who work in the kitchen, all those folks need to get vaccinated. They will have then a higher degree of trust in their safety being back at school. So I'm appreciative that the federal government has taken a leadership role there. And I think we're seeing now more momentum around a return to school. But we have to remind folks, the vaccines aren't going to solve all of the infection control activities that need to take place. We still have to do masks. We still have to do physical distancing in schools. We should be doing regular COVID testing in schools so that we can identify where there are any outbreaks and quarantine folks quickly. So I do worry a little bit in some states. Folks are moving, I think, prematurely, too quickly towards reopening. And the risk there is once again prioritizing bars and restaurants over schools. Because what will happen is if we move too quickly and we have another surge, then schools will have to close and students will be harmed again. So we've really got to be careful that we don't get ahead of ourselves.
So let me take that time to thank you very much, Secretary King. Dr. Coots and Dr. Geib, I want to talk to you guys specifically because one of the questions in the Q&A box is, talk to us a little bit about the unique differences in the shot, right? And what does each shot do? But let me preface that by saying, even if we all get vaccinated, well, not all, even if the majority of adults get vaccinated and the kids don't get vaccinated, what does that mean for us as a population as we look to open our doors, as Secretary King started to talk about? So first question is, what is the unique differences in the shot? And then secondly, how are we going to have a phased approach with this if some of us are vaccinated and others aren't? Dr. Coots?
Well, so I'm not a virologist or a vaccine specialist or anything like that, but I'll tell you, what I know. So certainly the first one to hit was the Pfizer vaccine, then followed by the Moderna. Both of those are mRNA vaccines, which use a portion of genetic material. So these are inert. There's no live virus involved in this or anything. And heretofore, it's been very difficult to create mRNA vaccines. So these are the first. So this is really sort of a game changer and earth shattering here too. Now that we've got the Johnson & Johnson or the Janssen vaccine on board, that is using a benign viral vector. That's not uncommon. Many of the vaccines that we have out today that we give use that same mechanism. None of the three of these that are out are harmful in the way that they were created or the properties that are in them. There are some people who may have an allergy to a component in it. We're finding that a few people do have allergies, but that is not the majority of people. And there are people who have allergies to components in vaccines all the time. So what I'm trying to say is these are vaccines. They're made in the same way we have been making vaccines for all of these years. It was just made on an accelerated basis. There are a couple of other vaccines that are coming out too, but pretty much they all use the same type of mechanism in order to create a certain level of immunity. So for the Pfizer, the Moderna vaccines, it's 2 shots. The first one sort of kind of preps the body. The second one upregulates the immune system. And so you get a little bit of a side effect with the first, you get a little bit of a stronger side effect with the second. And I think that that's what a lot of people are concerned about, are the side effects. You hear people say, oh man, it felt like a truck hit me. And I was thinking, man, I'm not sure I want to take that vaccine because I don't want to feel like a truck hit me. But then I said, I also don't want to die of COVID-19. I've seen too much death. And so I'm going to take the vaccine. And I had almost no side effects, a little bit of fatigue for one day, and that was about it. There are people who are on the fence. Yes, there are people who are on the fence who are not taking the vaccine because they're waiting to see their friends and family members who are getting it to see what their side effects are. And then they're deciding to do it. And, my hospital system is a microcosm of our society. I had staff members who did not take it in, number 2, come up and take it. No, I'm going to wait for a while because I want to see what everyone else gets. And we're thinking, hey, all of this stuff you've been saying for the last year, why won't you take the vaccine? And then, of course, there were some in the African-American community who cite the Tuskegee experiments and the known experiments, throughout the, sort of the racist history of American medicine in general, toward Black and brown communities that had a fear of it. And then we had people in the Latinx community who, especially here in Montgomery County, who are immigrants from other countries where they did not trust their own government. And then they get here, why would they trust our government? And those who may be not fully documented were afraid that if they popped up to come and take the vaccine, that the ICE vans would be circling around the hospital or the clinic, waiting to pick them up and deport them, when all they wanted to do was to get the vaccine. So you've got a cacophony of voices and conspiracy theories and emotions raging around this. But I think as time is going on and we're seeing that the vaccine, the side effects were not horrible, and more and more are available and you have more options, you're starting to see that more people are now coming on board saying, well, I think I will get the vaccine. And so I think that that's a good thing.
Thank you, Dr. Coots. That was thorough, and I appreciate that. Dr. Geib?
I would agree with everything that Dr. Coots said. What I'm the most excited about right now also is the fact that the J&J vaccine is only 1 dose. And I'm really hopeful that that'll give us an opportunity, because they're not cold storage issues like we had with the Pfizer and the Moderna vaccine, that it'll enable us to perhaps, get it out into the community more. Maybe there's an opportunity for mobile vaccinations, and we'll be able, with only one shot as well. So we're not going to be having to track people down for a second shot as well. And then, to add on what Secretary King had said about opening up too early and the concerns about that, is my line with my patients has been, we have been in this COVID marathon, this 26-mile marathon for the past year, and we're at mile marker 25. So what is the harm in going slow and be cautious and watch where the data is taking us? And so, that is my hope as we start to reopen with the vaccine and its rollout.
So I always thank you for that, Dr. Geib. I always like to say the wheels of the mill grind exceedingly fine. And so I'm okay with a little bit slower to the end of the race, as long as we all make it there together. Brooke, I want to spend some time with you, because you see this because you work with what we call, quote unquote, the frontline staff, right? Mm-hmm. Let's address what the frontline people are saying. And let me ask this question. I hear frontline and used in lots of different vernaculars. In your mind, what does frontline really mean?
I think it's, that's an interesting question there, because frontline can mean so many different things to so many different people. Frontline, we have our first responders, our doctors, our nurses, our firefighters, our medics, but we also have our teachers. We have those who are in the healthcare industry. We have our respite care providers who are going into the homes of families. And so you see that a lot of what I have heard was that they maybe opened up some of the tiers too fast when some of the teachers didn't even have the vaccines yet, or some of our first line workers didn't have the vaccines. And I've been hearing a lot of that. Why did they open up so quickly? Why didn't we get, our first responders get the vaccines first, our doctors, our nurses, and then slowly do the openings? But you do see lots of concerns coming from families who do have individuals coming in their homes. One thing, Easterseals has really taken precaution when we have our respite care providers coming in the home with wearing masks, temperature checks, things of that nature. But at the same time, they get concerned that certain people feel that they're not as fearful now, or they aren't as careful as they should be. And one of the concerns we hear is, well, if we have the vaccine, could somebody, be exposed to a different variant that we're not protected by with the vaccine we currently have, and then we spread that among the community. And then also, children and vaccines, that's a whole separate issue. But then you add in children with special needs or disabilities. And a lot of our families are very concerned about that. And the long-term side effects, how we do, trials on that, how do we really know it's safe? And then when you have hybrid school, that adds in a whole other dynamic. You have, your kids going to school twice a week, and then you have a respite care provider coming in your home, or a nurse, or, anybody of that nature, an ABA therapist, a speech therapist, occupational therapist. So now you're exposed to even more individuals. And one thing we've heard is that if a school does have a COVID-19 outbreak, or somebody does test positive for COVID-19, you don't necessarily know what class that is and what exposure your child had to that. So these are all concerns of the community for what we're hearing with opening up, with individuals coming in the home, but also children going out in the community as well. And then, it's not, the vaccines aren't mandatory, and it's up to every individual if they'd like to get the vaccine. So some parents feel, at what level can we ask, have you been vaccinated? So all these topics are definitely in the front line of conversation.
Brooke, I appreciate that. Thank you very much. I will tell you, this topic is going by way faster than I expected. We are already at 2:24, almost 2:25. Two favors, house cleaning. Number one, still remember, you can ask as many questions as you want to in the Q&A. Our panelists, if you are not speaking, please take some time, peek over there and answer those questions if you can. That's number two. But number three is, if you haven't answered the poll, please, now it's time to answer the poll. We're going to pull up those results at 2:30 and use that as we continue the conversation. So again, thank you everybody that's been chiming in. Secretary King, I want to come to you. And this question is truly important. One of the big reasons folks are pushing to open up the country is folks are wanting the kids to go back to school, right? There's, for lots of reasons, there's been this fall off of education, or this lack of community engagement and touching their friends. I will tell you, on a personal level, my youngest has thrived, right? We're very fortunate though. My children have computers. We have high-speed internet. He's tested 3 grade levels ahead, right? My daughter, who was in college, came home this semester. She just said she didn't want to live in a bubble and live in her room and go to college. And so as you're thinking about how this is going to engage, there's two pieces here. Number one, can you talk about what your thoughts are on the speed of opening up? And then number two, what are your thoughts of what I mentioned earlier on, of half of us are vaccinated, the other half isn't vaccinated? And I forget what is the physicist's name? He said, you know, when two of the states, and I don't want to throw the names out here, Mississippi and Texas, opened up, he said it's like going to stand in the corner of the swimming pool and using the bathroom, and everybody else is in the swimming pool together. So can you talk about that a little bit as we, you know, as you on the education side?
Sure. So I'll start by saying, I think as a country, having schools open should be priority number one. We know from the science that the rate of spread in schools, assuming people are following the procedures to keep everyone safe, has been very, very low. Whereas restaurants are a place where there's a lot of transmission. So I'm worried that states are getting their priorities backwards and sometimes rushing forward around restaurants and bars rather than prioritizing schools. So that's the first thing. We have to move quickly, I think, to safely reopen schools, and very cautiously with respect to bars, restaurants, sports venues, theaters, and so forth. That's the first. Second, the closure of schools has had a very detrimental impact for students. Now, we had public health considerations that drove those closures, but now we know enough to safely reopen. Why has it been so detrimental for students? Well, it's a few things. I mean, you mentioned internet access. Before COVID, there was a Pew study that showed 79% of white families have reliable internet access, 66% of Black families, 61% of Latino families. We literally have students around this country who haven't logged into school since last March. Think about the consequences of that. We also know we have a huge device gap. We still today have kids who are trying to do their schoolwork on their mom's cell phone, which they're sharing with their mom and maybe another sibling or two other siblings. Now, we could have handled this differently. The federal government could have stepped up and said, we're going to have a massive national mobilization to get every child a device and internet access, but we didn't do that. And so we are where we are. Kids have missed a lot of learning. We also know parents are very differently positioned. Only about 1 in 5 African Americans in the workforce can work from home. Only about 1 in 6 Latinos in the workforce can work from home. So some kids are sitting next to their parent who's supporting them around their learning. Other kids are by themselves, they're with an older sibling. Some kids are working to try to help their families given the economic crisis that COVID has brought. So we know there's going to be an academic harm. McKinsey did a study suggesting 6 to 12 months of lost learning as a result of the disruptions to school. But there's also been a huge socio-emotional and mental health toll to this period, and that cuts across race and class. Kids need the relationships with teachers and peers and the extracurriculars and the social interactions that define school, and they've been without that, and that has taken a toll. So now we should be focused on safe reopening and then a massive federal effort to try to address students' academic and socio-emotional needs. The good news is
more seasonal allergy things. And so I was one of those folks like, hey, I need it because I don't want to end up in the hospital. So again, as we're having this conversation, as an African-American male who does have access and who can work from home, I'm in that 1 of 5, but those other 4 are family members and friends of mine. So I appreciate you bringing that up as a point of contention here. Thank you very much. If we could right now bring up the results of the poll, and then Dr. Coots, I have some questions for you. There we go. So do you plan on taking the vaccine when available? This is really good to see. 56% have said yes, 30% already have it, 3% said no, and 8% have said waiting to see more results. Dr. Coots, that's why I'm going to come to you after this, have some questions. Do you feel safe? It is safe to reopen now. 81% say no. And would it make you more comfortable about getting the COVID vaccine? What would make you more comfortable? Ease of access, longer trial phase, fewer doses, more information about future impact. And then what is your age range? It seems like most of us are in the middle of the pack there, 35 to 65. So Dr. Coots, before I close this, there are two pieces of this, right? You feel it's safe to reopen now? 81% say no. This is really for Dr. Coots and Dr. Geib. Then what would make you more comfortable about the vaccine? Can we address those two things? Why aren't folks feeling comfortable? Was this a rush to market? And help us understand, what do you think can alleviate the fears of folks about this vaccine?
Yeah, so I'll start off with it. So it was a very fast turnaround to it. But if you remember, so this is a SARS virus. We had SARS a few years ago, and then we had MERS-CoV back in 2012, 2013, or 2014. So there have been labs that have been working on coronavirus vaccines for some time. There are affiliate labs around the world that have been working on this in countries that are usually more impacted by these coronaviruses than we are. So the basic structure of the work was there. We poured a lot of money into it and a lot of brilliant brain power into it. And that's really what ramped up the ability to get it out there. In terms of the trial time, yes, the trials were not as long as some other vaccine trials have been, but this was a worldwide pandemic where tens of people, thousands of people were dying on a daily basis. So you can't have an extended trial when you're trying to save lives. What did we know? We knew that it was good for about 3 months. That's because most of the trials were about 3 months long. Those people have had many more months on the vaccine now. So as every month goes by, we have more months of data on how well the vaccine is working. Will there need to be a booster shot? Well, we don't know, but we think it might be, because viruses do what viruses do, which is they mutate. The flu virus mutates every year. So the vaccine you take every year is sort of based on last year's and what the predictive change is going to be for the next year. We're looking at that same thing because you hear about the different variants that are out there. The J&J vaccine originally came out and people said, oh man, this is a substandard vaccine. And they're talking about giving this to Black and brown people. What's wrong with this? So that helped to spur the conspiracy theories and everything else. As it turns out, the J&J vaccine is actually a very good vaccine to keep you out of the hospital and keep you from dying and being in the morgue. So that is an important point of having this vaccine in this period of time. It is also more effective against one of the variants, the South African variant, than the others are. So in fact, it is a very good vaccine. It is not a substandard vaccine. And if you can get into communities and get to people who can't come back for 2 different vaccine shots and get them with 1 shot, it's great. If we can take that and turn it into a pediatric vaccine, vaccinate all the children so that next year when we open schools, not only are teachers vaccinated, parents vaccinated, but children are vaccinated as well, score, we've won.
Thank you, Dr. Coots. I appreciate that, especially the score part, because I like sports references. Dr. Geib?
No, I was just going to agree with everything that he said. But I also do think I think time is going to give people more confidence. The more people see their own relatives, their friends getting the vaccine and doing well, with the vaccine, I think that hesitancy is going to drop. If I may, I'd like to just add on to one thing that Secretary King was just talking about the children going back to school. And, I'm concerned about these kids who've been out of school and haven't had the support that the school communities have given, in the past. And adverse childhood experiences like poverty, food and housing insecurity, and child abuse, neglect, and mental illness, contribute to poor health outcomes. And the pandemic's health and economic impacts have made the risk of adverse experiences worse. And these have been more prevalent in minority kids. And so, for example, in Virginia, we know that about 40% of child abuse reports to Child Protective Services come from schools. And so those cases haven't been recorded, and we know child abuse hasn't gone away. So kids with these adverse childhood experiences, they're at a higher risk in the future of having academic problems, doing drugs, potentially even ending up in jail. But even more so, we now know that this kind of stress can cause toxic effects on the brain and affect genetic expression that results in potentially, diabetes and heart disease in the future. And the downstream effects in 30 to 40 years are potentially devastating. And so I wanted to just add that as well as to why, I think we need to get these kids back to school safely. So.
Well, I appreciate you talking about that, because I was just about to talk to Secretary King and Brooke on that piece of, we've been talking about the physical side of this disease and physically trying to get back in structures. But I will tell you, as part of here at Easterseals, we've seen our military uptick, where there's been more mental health counselors, more remote counseling. And Dr. Coots, you probably see this on your side of the business, where the mental health has been significantly challenged. I will tell you, I've spent more time this year stopping at 4:30 or 5 o'clock just to go outside and play basketball or take the kids on a walk. I've been intentional about doing that. Or I played Uno last night until 10 o'clock, and I didn't want to play Uno, but I played Uno because what I'm hearing from my children are, I want to touch my friends. I want to touch my friends. And I've been very intentional about my kids talking to their cousins via FaceTime. But I want to come to Brooke and Dr. King. Brooke, you first. Again, what are you hearing from those frontline staff about the kids that are in school versus the kids that are out of school? What are they feeling? What are the parents feeling? And how is everybody kind of doing with this together from a mental perspective?
Yeah. So, and I've been in contact with our families, and mental health in young children, adolescents, it's on a rise even more now. I have a lot of families that are talking to me that their young children are depressed. They are showing signs of anxiety, even at the age of 2 or 3. They're scared of germs. They're scared to touch things now. Or their child who is 9, who is used to going to play with the neighborhood kids, now can't do that. So that child's now getting depressed, getting anxious. You have a lot more kids now who are home alone that were never home alone before because parents have to work. They need to pay rent, they need to put food on the table. And so you see that with schools just starting to open up here in Montgomery County, for instance, the first tier was individuals with special needs or disabilities. And so, but there's a transition to go back to school. If children are having depression or anxiety, and then they're going to go back into the classroom, that can cause them more anxiety and depression. So that's something also that we all need to be aware of as parents, as teachers, that we could be seeing that. But children want to play with others. They want to be social. Even, young teenagers, this is almost trauma to them at such a young age. And you're seeing it. I mean,
well, not to interrupt, it's trauma to me having to talk to a high school freshman every day. I will tell you that is trauma, talking to a teenage boy every day. I'm joking.
No, yeah. I mean, it's you're seeing all different aspects. It's very hard for children with disabilities or special needs to learn virtually. It's very hard on the parents. Parents were burnt out before COVID-19, and now they're even more burnout than ever. And parents are having more mental health issues than ever. I mean, the really sad thing is you're seeing more suicides among teenagers and younger kids, and it's heartbreaking. And I do think that when we can safely return to school, we can get the kids, young teenagers interacting with other, students. That is so critical for them. Some students thrive off sports, whether it's basketball or football. That's their family there. They live up. Their coaches are their role models. There's so many different aspects of things. School, if you put aside the education side, it's where you build friendships. It's where you build a sense of community and family. And they're not getting this right now, and that's very difficult.
Brooke, I appreciate that. Thank you so much. I'm going to swing that into Dr. King, Secretary Dr. King. Can you kind of expand on that a little bit, and specifically the mental health, the gap, and then how you guys are looking at what the next phases of overcoming that space are?
Yeah, I mean, I agree with everything that Brooke said. And what I would add is that there are real equity problems in terms of our ability as a system to respond. So, we have states where the ratio of students to counselors is over 500 to 1. How is one counselor going to be able to effectively support the needs of 500 students? We also have 1.7 million kids who go to a school where there is a law enforcement officer and no counselor. Right? And so in those schools, trauma in kids' lives that causes them to act out, the only response is law enforcement rather than the support of a counselor. So we really have to be very attentive to getting resources to our highest needs schools, those schools that have the, the lowest tax property base essentially and don't have the resources. We have to get resources to those schools to address mental health needs, counselor needs. And then what I would love to see us do, and there's some money in the, so almost $1 billion in the relief package that could go towards this. I would love to see us mobilize a national tutoring corps, use programs like AmeriCorps, get recently graduated from college young people, but also retired teachers, and mobilize them as tutors, both to address students' academic needs, but also to build positive mentoring relationships so that we can help students re-engage with school and address some of that yearning that they have for a connection to other people.
And I think everything you said is right on. And something else I want to add is it's really sad, but there is a stigma in our community regarding mental health. And people feel that if they're honest about it, if they tell a friend or a neighbor that their child's suffering from depression or anxiety, or they're going to be looked at differently. And some families feel a sense of pride that they can't share that information. So they kind of feel like they're stuck, keeping this all inside. And I truly wish there wasn't such a stigma on that, and the stigma on reaching out to get help and services, because more than now than ever, individuals are going to need it. And I like the idea of having different partnerships among communities, organizations join together to work with the children, to the young teenagers, especially those who are not in the communities that have those resources readily available, because it is so important that they get the help necessary and that we kind of break down those barriers of stigma of mental health.
I appreciate that. I want to jump in and first pause and say, this is super engaging. I'm getting text messages on the side. You guys, can you please peek, you guys meaning panelists, can you please peek into the Q&A? Folks are asking some really poignant questions there, and you can answer them directly. But I want to use this opportunity to say, both Brooke and Secretary King, you guys talk about the mental health, and without even saying the Black and Brown communities, that number is probably quadruple to the numbers that are you're mentioning. I can tell you, not on a me personal level, but again, I'm using my explanation of Chicago. Violent crimes have gone up, carjackings have gone up. Kids that just from poorer communities. My community that I grew up in was like West Baltimore on an expansive scale in Chicago. Those kids aren't going to school. They just aren't. They weren't halfway going to school before, and now they really aren't going to school. And so you're seeing violence, and you're seeing the mental health, and you're seeing those things trigger. And so it is a challenge. And I agree that while we're falling further behind there, then you have the prison industrial complex, you have the mental health facilities. There's lots of layers to this that I wonder what's going to come out of it on the backside. Question that was posed that I think is really important is, without mentioning specific names, why wasn't there generally a national strategy on the pandemic as a whole until recently?
Well, can I respond and mention names?
You can.
Because I'll tell you. So, a few days before the inauguration, in January of 2017, we had a joint cabinet meeting, the whole Obama cabinet and the whole Trump cabinet. And this was something the Bush administration had done for the Obama administration. Really, it's about continuity of government. As Dr. Coots knows from his military service, there are all kinds of challenges the country can confront, and you want an incoming government to be prepared to deal with those challenges. Well, we spent about 4 hours together doing tabletop exercises, talking about potential crises that we might face as a country and trying to help the Trump team prepare to respond to them. I will tell you that one of the crises, and this has now been public, one of the crises we talked through was the risk of an airborne pandemic from overseas and what the appropriate federal response would need to be. And so, the Trump administration just did not use the playbook that had been designed for how to respond to these kinds of crises. And that has cascaded through the last year. It resulted in inadequate communication to the public, inadequate response in our healthcare system. And then, there was a smart decision to invest resources in the vaccine, but inadequate preparation for efficient distribution of the vaccine. So
Dr. King, Secretary King, I appreciate that. Let me jump in and kind of ask or pause and then go to Dr. Coots. So I appreciate that. Without us getting super political, because we could all have our political stance. Do you think this thing came up, and Dr. Coots, I want to go to you, but first of all, Dr. King, Secretary King, I really appreciate you saying that. Was this thing, did it come on too quickly? I know that we've talked about this airborne piece for long periods of time. Did it come on too fast? Were we just not able to handle it? Were we ill prepared, not necessarily just as a government organization or as a communicative? And so, Dr. Coots, I want to come to you. Was the healthcare, and Dr. Geib, were we prepared for this in the healthcare system as a whole as well? Because what you realize is this is only 2 or 3 or 4% total of the population getting sick like that, and it seems to be blowing our doors off.
So I'll tell you from a couple of sides of my background. So from my military background, so I retired as a brigadier general. And so we had Pentagon drills and everything else when it was the original SARS. We had drills when it was MERS-CoV. We were doing tabletop drills, just as Secretary King mentioned, for ourselves because of the constant threat of a potential bioweapon or something like that being unleashed on the home world, the American population. I was the commanding general of medical over in Europe, and we were doing international drills in NATO around the same thing. Coming here to Holy Cross, because of the Ebola outbreak that we had, we established special pathogen assessment hospitals in every state. There are 5 here in Maryland. Holy Cross is one of them. So we thought we were prepared for this, and that is why the first patients were originally brought to us. Our first patient came to us on the 24th of January to rule in or rule out, and we ruled it out. We had already stood up our Incident Management Command Center because we had been watching since November the things that were going on in Wuhan, and we were very suspicious. And we thought that we were prepared for it because we were a special pathogen hospital. When we got those first few diagnoses, we said, okay, let's pull out our sets and kits. We opened up the FEMA kits. Everything was decrepit. Nothing had been replaced. The PPE was in a shambles. So we quickly started replacing that. And before we knew it, we were overwhelmed with patients. Our special pathogen, our Ebola prep could not keep up with what was hitting us because we waited too long to activate our systems.
So Brooke, so thank you for that. Brooke and Dr. Geib, please feel free to chime in on this. Brooke as a frontline and Dr. Geib as healthcare. And then we're at 2:50. And I always like to make sure at the end we give everybody a chance to really speak on this topic. Again, I want to thank you guys. This is we could probably spend 2 or 3 hours here. This has been fantastic. I think the audience, as by the number of questions we're getting, has been very good. So Brooke, can you talk to this a little bit about the impact of what has happened as far as rollout is concerned, has impacted what you're seeing? And then Dr. Geib, same question, and then I'll come back to each of you individually.
Well, and I think kind of tie into that is I did see one of the questions was related to individuals with disabilities and that, the struggle with them to get the vaccines and that a lot of them are left on their own. And so that is a very good question. And one that I wish we were able as a community, as a society to help those individuals more. I know some states were doing, if you brought a let's say 55 and better to get a vaccine, you were also able to get a vaccine. I think we definitely need to find more support services to those with disabilities and special needs to help them get those vaccines. And there are different Facebook groups where individuals are offering their time to help them find a vaccine, but also then you get into transportation issues and things of that nature. But I have found that the community is really coming together to help those, especially those who don't maybe have the resources or are just struggling to find those vaccines. And then I think and sorry, Darnell, I'm kind of skipping over your questions a little bit, but I did also just want to mention that somebody did say, the impact that it's had on caregivers. And we are seeing that with frontline workers too. Before COVID, it was stressful enough, but now as a frontline worker, as a caregiver, they are kind of at their tipping point. They're not getting the respite they need. And respite is something that is so needed. It is critical. Everybody knows that if you're not at your best, then you can't be the best parent, you can't be the best caregiver, you can't be the best on your front lines. We have firefighters that are seeing more suicides. We have officers that are seeing more domestic violence, and that takes a toll on everyone. You have veterans who have come back with PTSD, and COVID-19 has brought up all these issues. So if you're not able to take care of yourself, that impacts your family as a whole. And I think everyone is at a higher level of stress than they ever were before. And I think that self-care is really important, whether it's going in a room or just taking a minute to breathe is critical for everyone's well-being.
So Brooke, I appreciate that. I'm going to say thank you. And we've got 8 minutes here. I want to offer everybody a chance to close, but my close question for each of you, and I'm going to start with Dr. Geib, is this. Talk to me about all the good things. Talk to me about the positive things and the things we can do on a span of where we've been versus where we are now and where we're going. And what's your take on that?
Yeah, well, I think we're moving in a very positive direction with the vaccine supply. But I do want to close with just saying, we have a group, we talked about vaccine hesitancy. We also have a group of people that are actually just going to refuse the vaccine. They're not hesitant, but they're going to refuse the vaccine. And what can we do about encouraging vaccines? And I think communication from trusted sources that's what's essential to alleviating vaccine hesitancy and to counteract misinformation. So I can tell you what we're doing, at Cigna is we're trying to share as much information as we can that's science-based with our clients and customers and patients about the safety, efficacy, and availability of these vaccines. We've given webinars, podcasts, we're giving e-cards, anything we can to our, to our customers, our clients. And I think that is the key, just to continue to give out trusted information so people can get the truth.
I appreciate that. Brooke, I want to come back to you, and then I want to close with Dr. King, Dr. Coots.
I think it's important that everyone's supportive of everyone at this time, and we respect everyone's beliefs and opinions. I think one thing that I've noticed is it's so easy to go on Google and type in vaccines, or anytime you think you're sick, you type something in, and you get all this information that isn't even correct. So I think it is important that everyone is getting the correct information, that it is from a valid source. And that is something that I think is really important. And then also just, like I said, it's the support of our community for each other, and that you're not putting somebody down if they're not getting a vaccine, that you're kind of helping them in a sense to more reliable sources, to individuals they can talk to if they do have those questions, I think is really key. And I hope that as more of the community gets the vaccines, we can start slowly opening things up so that everyone's mental health across the lifespan can get to a better place. And that for those who are in areas that aren't as privileged, we can provide more support services to them as well.
Brooke, I appreciate that. Fantastic answer. Secretary King, I want you to speak to this from the education piece. And then Dr. Coots, I'd like you to talk to this from the family, the hospital piece, as we bring us to close.
Yeah, I hope we come out of this period much more conscious of how fragile our social safety net and health infrastructure is as a country, and that we are now prepared to make the investments necessary to strengthen those going forward. Because unfortunately, we know this will not be our last pandemic. And we've really got to take some lessons from this experience to strengthen our systems in schools. Now that we've leveraged technology in the way that we have, I hope that there will be some positives that come from that. This was a disaster. I don't want to characterize anything as a silver lining, but we've long had a problem that high needs urban and rural students have not been able to get the same access to AP classes or dual enrollment opportunities with college classes. And too often kids have been told, you can't take that class because it's not offered in this building. Well, no kid should ever hear that again, because we now have seen that we can leverage technology to make more opportunities available to kids. That's a good thing. We've seen parents having access to their kids' schools in a different way. I've talked to principals who held a parent night on Zoom
Mhm.
and had many more people than they would have regularly because it was more convenient for them to tune in from home without having to get childcare, without having to commute to the school building. So we should take some lessons from that and leverage that technology. And we should learn the lesson that today in the 21st century, internet access is like electricity was in the mid 20th century. In the New Deal period, FDR said we can't have people without electricity. So invest in the Tennessee Valley Authority and try to make sure folks would have access. We've got to do the same thing now. Without internet, can't access school, can't access telehealth, can't sign up for the vaccine, can't look for a job. So we really have to make sure that everyone has that internet access.
Secretary King, I appreciate that. Thank you so very much. We're going to close with Dr. Coots, and then I'll bring us to close and bring John back, our CEO, for some final last words.
So I'll tell you, as a health sector and healthcare organizations, we have learned so much. We're learning new things on a daily basis with this pandemic because of this virus, but we're also learning what our weaknesses are as health systems and where we need to shore up things and tighten up. One of the things that this pandemic has done is it has laid bare the inequality and the disparities in healthcare in America today, which is an absolute travesty. On top of that, the racial unrest, the social unrest of this summer helped to open that and make that more apparent. What Secretary King said, he mentioned something. He mentioned telehealth and telemedicine. Telehealth and telemedicine has leapt 10 to 20 years ahead of where it was. And I hope it never goes back in now that this horse is out of the barn. Don't ever put it back in, because it has given access to so many more patients that never had access to care. And where we are finding that patients don't have the right type of telephone or don't have internet, some of our clinics are actually giving burner phones to patients so that they can use them. But what this does is this opens an aperture into how our patients actually live, because just as I am looking over everybody's shoulders at what your rooms look like behind you, so we can do with our patients. We can see how safe their work environment or their home environment is or is not, which, you talk about those social determinants of health, you get right into visibly seeing those social determinants live, whereas a patient in your office, you may have to pry it out of them or never get it out of them that these things are there. Then you can now take it one step farther to what they're now calling the moral determinants of health as well. We have a moral obligation to get to true health equity in this country, not just health equality, but health equity, which means the right health care for the right patient for the right reason at the right time and at the right place. That is where we are heading. And this pandemic, this virus, has finally gotten us here. So if there is a good thing out of it, it is a great societal change around who gets health care and realizing that health care is truly a right and not a privilege.
So I want to personally thank you guys. This has been fantastic. I wish that we had another hour to go because there's so many more questions we have. I would ask you two things. One, if you guys can peek at the bottom, we have 4 unanswered questions. If we can answer those while our CEO, John Horowitz, is talking and bringing us to close, I'd greatly appreciate it. Thank you guys for allowing me to moderate this panel today. Appreciate it.
Well, that was a fascinating and stimulating discussion, and I really appreciate where we ended up, and Van, your points about the importance of health equity. That is such a key focus for Easterseals as well, and why we were so glad to have this panel. And thank you all for your amazing contributions and feedback.
So again, thank you guys very much for your time today. Thank all of the people who joined us today and asked questions. This has been recorded and we will be sharing it on our YouTube page as well as across many of our social media veins. I'm Darnell Burden, Vice President of Development. Dr. Geib, Brooke, Dr. Coots, Secretary King, thank you guys very much. Have a fantastic remainder of your day.
Thank you.